Hello. Hey, thanks for coming back or finding me, however you guys found me. Today, as promised, for a little while, we're going to talk about paresthesia and what I've found through the years, and I've been using this for about 15 years now. Paresthesia. So, how do we deal with this? Most of the time, when we're talking about nerve issues with what we do as far as dental, oral surgery, periodontics, and so forth. So, I do get a lot of questions about this, and this is just a typical question. This person asked, hey, so what's the most effective nerve post-treatment after wisdom teeth removal surgery? What he's talking about is if there's a nerve issue, you take a tooth out and now the patient has some numbness in their lip or chin. What do you do? Or what if you think that might happen because a nerve looks close on an x-ray? Do you do anything before or during or after surgery to help with that and so forth? So I get a lot of those questions. If you look at my cases on my other account, the Dr. Wahan account, you'll see a lot of the wisdom tooth surgery in full. And I have some cases in there that actually show the nerve, and you can see it. And sometimes we do see it, obviously, in surgery. So what do we do? When you look at an x-ray like that, what do you do? What do you tell the patient? How do you manage it and so forth? Without getting into all of the surgical aspects of nerve repair, that's a whole separate thing. What I'm talking about today is a patient, let's say they come in, you take out a tooth, and they come back for a follow-up and they say, hey, I got a little tingling in my lip, in my chin area. It feels a little funnier on this side versus this side, which feels normal. And likely there's some sort of paresthesia to that nerve, right? So there's nerve testing you can do, and we're not going to get into all of the testing for it because, again, that will make this quite long. What I'm talking about is if you know what you're talking about and you have a patient with those symptoms, is there something that you can do that's over the counter even to help with that, and is there any validity to that? And there actually is. So what I've been doing for about 15 years is I'm kind of borrowing from other places. And what I mean by that is there's already pretty good data out there for some antioxidant over-the-counter supplements, basically, that you can take to help with nerve issues like neuropathy, diabetic neuropathy, alcoholic neuropathies, cancer-induced neuropathy, and paresthesias. And so what we're doing is we're borrowing from that literature that's already there. There's PubMed studies and so forth on this stuff. And what I found is, and a lot of oncologists also recommend these things for nerve issues. So the three that we're going to talk about today are basically alpha lipoic acid. The other one is glutamine or L-glutamine, and just a B complex. And you're using some of the B vitamins in there. It's just easier to get the complex, I think, and rather than micromanage it all. So those are the three. You can get them from Amazon, which you can do. It's easy, it's convenient, but just beware of counterfeiters on Amazon. So you should know where your seller is and if they're reputable. Or kind of go directly through the companies. These are all from Thorne, pretty reputable company for this sort of thing. So yeah, just kind of research on that. But yeah, you can get them from, over the counter. You don't need a prescription for them. And they do have good data to help with this sort of thing. So what are we talking about? So there's the case here. This first case you're looking at, basically a wisdom tooth sitting on the nerve. You see that one root's twisted kind of underneath it. Just both of those roots are right along that nerve canal. These are all teeth that I've already removed, by the way. So yeah, we take this out, and then if there is a nerve issue, we can manage it. And I'll show you. There's another tooth. There's another wisdom tooth here. You can see that both those roots are right near that nerve canal on the two-dimensional film. This third case here, a little bit deeper. You see there's a food trap above that tooth too, that little dark area above that crown. Yeah, so there's a little food trap that's been forming on this partially impacted wisdom tooth. And those roots are really close to that nerve canal as well. And lastly, on this case here, same thing, just a typical mesioangular wisdom tooth. The end of the roots are in the same plane as that nerve, right? You see that. So Memorial Sloan Kettering Hospital is one of the premier cancer centers in the world, right? They actually have a really good site. If you go to their page and you search, vitamins, supplements, and things, they have a whole separate area where you can look up pretty much any herb, and they'll tell you, hey, this is helpful for this sort of treatment and this sort of treatment, and obviously, it's coming from a pretty reputable place, so it's a nice place to go rather than just some rando site on the internet. So yeah, go to Memorial Sloan Kettering, search for herbs on there, and you'll find these search pages, and it's pretty helpful. So the main thing when you're choosing supplements is like brand, cost, And you want to get a higher dose, so you don't have to take as many pills, and so that helps with patient compliance and things like that, right? So, yeah, so those are the things you kind of look for typically when you're getting buying supplements from random places. We'll get into the first one, alpha lipoic acid. So I looked it up on Up to Date, and Up to Date, if you don't know, it's pretty much got me through medical school, and it pretty much gets most doctors through their day, every day, almost, right? So if you don't know what Up to Date is, it's peer-reviewed stuff that continuously gets updated. So you can look up pretty much any medical, almost even surgical issue on there. And this isn't for you guys, the consumer mainly. This is really for professionals. So it does require a hefty subscription fee and a license and so forth. But yeah, your doctor sees you and they leave the room. Maybe they're going to go back and look up something on Up to Date, then come back with your treatment. So it's pretty much that useful. So yeah, I looked up these things on Up to Date as well because I have full access to that as well. And yeah, they're also on there for these same issues. So it's just not the Sloan Kettering website. It's peer-reviewed stuff. So alpha lipoic acid, they're saying you can take up to 600 milligrams a day of alpha lipoic acid, which is helpful. So that's one of them. And this study here, basically just looking at alpha lipoic acid in diabetics, so diabetic peripheral neuropathy, and they found that it's a powerful antioxidant, which we knew, but this study found that it significantly decreases the incidence of depression and peripheral neuropathy in patients with type 2 diabetes. So this is just one of many studies, but yeah, just showing you that there is data on these things. I'm not just selling snake oil. But yeah, so the other one is glutamine. So typically L-glutamine, you can read it says 10 to 30 milligrams per day. Up to Date says 500 milligrams a day is fine. You can get it as a powder. And the reason for that is because you can use it for neuropathy. It does require a higher dose, so you can dose it easier as a powder that way if you're going for the higher dose regimen. So we've gone over for alpha lipoic acid. The other one is glutamine. And again, on PubMed, if you go on PubMed, you're going to find some studies with glutamine. And this one's saying it's for the treatment of vincristine-induced neuropathy in children and adolescents with cancer. So they're studying it in patients with neuropathies from cancer treatment, and it's well tolerated, and improvements in sensory function and overall quality of life and so forth. So yeah, we're kind of borrowing from that data, but again, we're using it for a similar thing with peripheral nerves, right? And you can use it to treat weakness and loss of muscle mass, treat neuropathy, which is the numbness and tinglings in the hands and the feet and so forth, and things like that. Bonus effect, it can help your recovery after surgery by reducing your risk of infection, which is cool. So that's glutamine. The other one is B complex. And I say B complex because you're using a few of the B's in there. Might as well just get the complex. It's just easier to dose. And this study found that it significantly improved symptoms of alcoholic polyneuropathy. So these three things, what I usually do is when I see a patient, let's just say they come out 7 days later for a follow-up and they have a little bit of numbness in their lip or chin. And, I look at it, make sure they're not infected. Locally, everything looks like it's healing okay. They just have that sensory deficit. I'll prescribe these three things, and it's really not even a prescription. It's, hey, I write them down. Hey, get these. Get them. You can get them from Amazon, or if you go directly to FullScript or other places, or you get them directly from Thorne or places that sell legitimately, that's probably safer. But yeah, take them. And I see them a month later, like 30 days later, and I retest their sensory deficit and to make sure they've been on those. So to be honest with you, I have very few, in the past 17 years of doing surgery and so forth, very few lasting paresthesias. If you do enough of these surgeries, you're going to see this stuff, trust me. I mean, everything's going to happen, right? But if you manage them correctly from the beginning, and if these aren't transections. We're not cutting the nerve. This is really usually just from a swelling around the nerve because it's just close. It's still intact, right? If there's a transection of the nerve or something like that, you can do a surgery or two to help with that. We're not talking about those patients, although this would still help, I think, just in those patient populations, but it's not going to cure that. These are sensory deficits, likely from the nerve just being really close. So I hope that's helpful. If you have any questions, let me know, and thanks for coming out.